Hi there. I'm Dr. Tara Karamlu. I'm a pediatric heart surgeon at the Cleveland Clinic and the director now for the fourth year in a row of the AATS CCF Cleveland Clinic sponsored Honoring Our Mentors program. With me here today are two of our outstanding young cardiothoracic surgical residents who have been awardees of the symposia this year.
Hi, I'm Aaron Clark. I'm a PGY5 at Northwestern University. I'll be pursuing a career in adult cardiac surgery. I'm most interested in structural heart and aortic aneurysm and repair.
Hello, I'm Laura Scrimger. I'm a third-year fellow at UCSF, also interested in adult cardiac and planning to do additional structural heart training.
So I'm going to ask both of you just a couple of questions. But the first one, obviously, we're talking about a mentorship and leadership program, which is really unique in providing young residents who are about to leave their training programs with some tools that they may not get in residency training. Things about structuring your career, how to be successful in today's job market, and how to capitalize on leadership opportunities that might come your way. So naturally, I want to ask both of you, who was your mentor? Who inspired you to be a cardiothoracic surgeon?
It's a great question. I think a lot of us have a story about one surgeon or a number of surgeons who initially got us interested in cardiac surgery. Mine was Daniel Beckman. I was a medical student at Indiana University. And my family had known him for a long time, and he offered for me to come into his operating room. And you'll never forget the first cardiac surgery you see. It was a mitral repair. And I was so impressed by the technical abilities. I was already interested in the physiology and pathology. So that was really the culmination of seeing all that understanding, culminating in the operating room for taking care of a patient. And so I attribute a lot of my interest and a lot of my early success to Dr. Beckman. And forever grateful for his mentorship.
That's wonderful. Yeah, the first time you see that heart beating, it's pretty inspiring and visceral.
Absolutely. For me, similarly, it was in medical school. I was at University of Colorado and doing a type A dissection with Dr. Brett Reese. And I think it just was a mind-blowing operation. And I just wanted to be back in the OR every day with him after that. So it's been wonderful.
Yeah, Dr. Reese is wonderful. Tell us a little bit about some of the pearls that you picked up from the Honoring Our Mentors Symposium. What were the resonant messages for you?
I think for me, one of the most interesting things that I hadn't thought of prior was how malleable you are as an early surgeon. A lot of people come out early in their careers saying, I'm going to be an aortic surgeon or a mitral surgeon, etc. And sometimes Dr. McCarthy always said you need to be a hand surgeon, operate on what you can get your hands on, and then you can decide thereafter
That's great.
What you want to build your career into. Obviously, he built it into mitrals after being a heart failure surgeon for many years. And so I think talking to a lot of the staff, they talked about how malleable they were as early surgeons until they really got the opportunities to talk to their section chief or their chairman about what they wanted their career to look like in 10 years, for example. And it's great to see all of them ended up exactly what they wanted to do. But sometimes that goal changes. And so malleable both as is your goals internally, but also taking on what is best for the department. I think the malleability was probably the most important thing that I learned.
I agree. I think that was one of the most memorable things, learning about you can have one interest, but really if there's either a need of the department or a need in the field, that can change over time. And I think that was a really fascinating thing to see and hear, and especially at a place like the Cleveland Clinic that has such an extensive breadth and depth of surgery, and seeing the way that people's careers have been changed by that. And also internationally, the work with that I think was really interesting as well.
Yeah, I think one of the things that the messages of the symposia, even that I took away from it, as I hate to use the word senior, but senior surgeon, is that you don't really do things the same way I do almost nothing the same way I did the first day out of residency. And you pick up things, you evolve from the colleagues that you interact with every day, and coming to meetings like the AATS where you're on the cutting edge of innovation. The last question I wanted to ask both of you is what would you tell other cardiothoracic surgery residents if you could give them any advice going back from your first day as a intern? Just maybe in one sentence, what advice would you give?
The advice that I would give is, and I think a lot of people would echo this, is hard work. Continue to work hard, not only for yourself and the career you want to build, but for your patients. And I think a lot of great things can come of that. Surrounding yourself with people that support you, as we talked about, mentorship is key. But I think when you work really hard, great things come of that.
I think I would say don't lose the joy and the spark that was what really brought you to the field, because there will be long hours, there will be lack of sleep. There's a lot of work that goes into this career. But if you remember how exciting it is to be in the OR and the difference that you can make in someone's life, then I think that's what keeps us all going.
That's terrific. Well, thank you so much. And please consider applying for the Fall Symposium, which is held. You get to go to a Guardians baseball game, and you will learn a tremendous amount about being a young academic cardiothoracic surgical leader. So thank you.